How to use an ovulation predictor kit the right way. As a fertility doctor, one of the most frequent questions I hear from patients revolves around ovulation testing and tracking. It's a topic that comes up constantly in my practice. And today, I want to dedicate this time to breaking down exactly how ovulation tests work and how to use them effectively. Believe it or not, this is one of the most fundamental aspects of trying to conceive, yet it's also one of the areas where I consistently see people making mistakes. This channel exists to spread fertility awareness and provide reliable education, so if you find this information useful, please hit that subscribe button and show your support. I've also created a full-length video that explains the menstrual cycle in detail, which I highly recommend as a companion to this one. Now, before we dive into the mechanics of using an ovulation predictor kit, I need to share a critical piece of advice. The honest truth is that if your menstrual cycles are irregular, you really should not be focusing your energy on tracking ovulation at this stage. Doing so can be an incredibly difficult, frustrating, and even expensive endeavor, especially if you're spending money on ovulation tests that may not give you clear answers. So I want you to be smart about your decisions. If you fall into the category of having irregular periods, here is my #1 piece of advice. Stop watching this video right now and go see a doctor. Seriously. Close this tab, call your healthcare provider, and schedule an appointment. That is the most important step you can take. The rest of this information is for those who have already gotten that medical clearance and have regular cycles. All right, with that out of the way, let's assume your periods are regular and you're ready to take a more strategic approach to conceiving. You want to pinpoint your ovulation date so you can time intercourse more accurately. So, how do you actually use an ovulation predictor kit? Let's start with the basics. First, you need to get your hands on a kit. You can walk into any drugstore and buy a box, or you can order them conveniently from Amazon. I'm showing you a mid-range option here, but the shelves are filled with a wide variety of brands and price points. However, I want to emphasize one thing. You should look for a box that contains a generous number of tests. You are not going to need just 1 or 2 for this process. You'll likely go through several over the course of a single cycle. You also have a choice when it comes to the format. There are the basic test strips that require you to pee into a cup and then dip the strip in, which are perfectly fine and very cost-effective. Then, there are the more advanced, easier-to-use sticks that you can simply pee on directly. I'll show you both types today. So, your first step is to open up your box. Once you've done that, take out the instruction leaflet, glance at it, and then, I'm not joking, throw those instructions away. In my professional opinion, they are not particularly helpful and often lead to confusion. Just set them aside and focus on what I'm about to tell you. Now, inside the box, you'll have your testing kit. As I mentioned, there are the economical dip-style wands, which work perfectly well, and then there are the expensive, fancy digital versions, which I will also discuss in detail. The important thing to understand is that both types work on the exact same biological principle. The only real difference is the user experience. With the more expensive version, you don't have to deal with collecting your urine in a cup and dipping the stick. You just pee directly onto the absorbent tip. Whether you prefer the cup method or the direct stick method is entirely up to you. It's a personal preference. To show you what a typical mid-range kit looks like, here it is. This is what you get, a simple, straightforward device. For this particular brand, you simply pull off the protective lid and then you pee on the designated absorbent part right here. You'll see a little mark indicating the area you need to wet. So, what is this test actually checking for? It is detecting the presence of luteinizing hormone, often abbreviated as LH. Now, LH is a hormone that is present in your body all the time, but what you are really searching for is a sudden, dramatic increase known as your LH surge. This is where ovulation predictor kits can become confusing, subjective, and especially problematic for women with polycystic ovary syndrome, or PCOS. As I've covered in my dedicated PCOS video, women with this condition often have an elevated baseline level of LH. Because of that, they are much more prone to getting false positive results on these tests, which can be incredibly frustrating. For this reason, I typically do not recommend OPKs for women who have PCOS, as it often leads to unnecessary anxiety and confusion. Let's do a quick review of the ovulation process to set the stage. Every month, a group of eggs is recruited from the ovarian reserve. Each of these eggs begins to grow inside its own tiny fluid-filled sac called a follicle. The brain sends out follicle-stimulating hormone, or FSH, which signals one dominant follicle to continue maturing. As that follicle grows, it begins to produce estrogen. When that estrogen level reaches a certain threshold, specifically over 200 picograms per milliliter for a sustained period of about 50 hours, the brain receives a clear signal. We have a mature egg ready to go. In response, the brain unleashes a massive surge of luteinizing hormone, or LH. This LH surge is a one-time event that finalizes the maturation process of the egg, a process known as meiosis, and triggers the follicle to rupture and release the egg. This rupture is a normal part of ovulation, and it is perfectly fine. Once the egg is released, it must be swept up by the fallopian tube. If sperm are present at that time, fertilization can occur. However, the egg has a very short lifespan, only about 24 hours. So knowing exactly when you ovulate is incredibly helpful for timing intercourse. Now, here is where a lot of people get it wrong. Many women are told to use an ovulation predictor kit with their first morning urine, and I can tell you that this is one of the biggest mistakes I see in my practice. There are two key issues. When do you start testing, and what time of day should you test? Let's address the timing issue first. LH is released from the brain during the early morning hours. It's a hormone, and hormones travel through the bloodstream to reach their target organs, in this case, the ovaries. But when you're using a urine test, you are not measuring the LH directly in your blood. You are measuring the LH that has been filtered out of your blood by your kidneys and excreted into your urine. This filtration process takes a significant amount of time, several hours, in fact. That's why I strongly advise against using the first morning urine. Instead, I recommend testing in the middle of the day, typically between 10 a.m. and 2 p.m. This allows enough time for the morning's LH surge to travel through your system and become detectable in your urine. So, if you've been using first morning urine, stop doing that. Start testing later in the day. The second question is when to start testing. You want to start testing a few days before you are scheduled to ovulate. Let's do some basic math. In a regular cycle, the luteal phase, that's the second half of your cycle after ovulation, is fairly consistent. After the follicle releases the egg, it transforms into a structure called the corpus luteum, which produces progesterone to support a potential pregnancy. This corpus luteum lasts for about 14 days. So, if you have a 30-day cycle on average, you can calculate your expected ovulation day by subtracting 14 from 30, which gives you day 16. That means you would likely ovulate around cycle day 16. You don't want to start testing right on that day. You want to start a little earlier to catch the surge. I usually recommend starting about 4 days before your anticipated ovulation date. The manufacturer's instructions often tell you to start testing about 10 days before your expected ovulation. Why? Because they want to sell more tests. But in my opinion, that will just drive you crazy and cause unnecessary stress. If your cycles are 28 days, for instance, 28 minus 14 equals day 14. So you would start testing 4 days before that, which is cycle day 10. This gives you a comfortable buffer to catch your surge without starting too early. So, to put it all into action, wake up and go about your normal morning routine. At lunchtime, around midday, take out your test. If you're using the stick version, pee directly on the absorbent tip as shown. After that, you'll watch the test develop. There is always a control line that is set to a certain threshold of LH. What you are looking for is the test line, the second line, to be as dark as or darker than the control line. That is what indicates a positive result. It means your LH has reached a level high enough to trigger ovulation. Now, here's a critical point to remember. The LH surge is the trigger from your brain to release the egg. So, getting a positive OPK does not mean you are ovulating that exact day. It means you are going to ovulate the next day. A positive OPK is a predictor of ovulation, not a confirmation of it. If you are trying to get pregnant, this timing is everything. You want to have intercourse on the day you get your positive test, and again on the following day. Since the egg only lives for about 24 hours, any sexual activity after that is simply recreational. It won't lead to conception. Another frequent mistake I observe is that women continue taking the test long after they have already gotten a positive result. Let me be very clear. There is absolutely no reason to keep wasting tests and money after you've received that positive. Friends, stop testing the moment you see that positive result. Put the rest of the tests back in the box and put the box away. If you are not pregnant this cycle, you can save them for next month. There's no need to keep checking because LH will continue to surge in a pulsatile on and off fashion throughout the entire luteal phase, which can lead to confusing results. One common question I get is about progesterone. How do you know if your progesterone level is high enough to support a pregnancy? Women often become very preoccupied with their progesterone levels. Remember, progesterone is produced by the corpus luteum, which is the remnant of the follicle that released the egg. Because the corpus luteum is responsive to those pulsatile LH surges, progesterone levels also pulse and fluctuate throughout the luteal phase. Therefore, you do not need to obsessively check your progesterone levels after ovulation. If you have confirmed that you ovulated, your body will produce progesterone. That progesterone level can range anywhere from 3 to 40 nanograms per milliliter throughout the entire luteal phase, and any value within that range simply indicates that ovulation has occurred. It's not about the specific number. It's about the fact that you ovulated at all. Now, let's talk about the dip-style urine tests. These are those tiny little strips that you may be more familiar with. To be honest, if I were to crack open the plastic casing of the stick test I just showed you, this is exactly what you would find inside. This is the small absorbent paper strip with a pad at the bottom that actually does the testing. It's connected to the plastic casing. Inside this little strip is dye. As urine moves up the absorbent material, the dye reacts with the LH in your urine, and if you are experiencing a surge, a secondary line will appear. It is a very simple, straightforward mechanism. So, if you are using the dip test, you are essentially using the exact same technology. You pee into a small cup, dip this strip in for the recommended time, and wait. The result you see is the same as what you would get from the more expensive plastic stick. Both are testing for LH. There is also the digital test option, which is another popular choice. However, digital tests can be quite confusing because they come in multiple varieties. One type of digital test works exactly like the basic line test. It tests for LH and gives you a simple binary result, a smiley face if you are positive and a blank circle if you are negative. It has a predetermined cutoff level for LH. This one is my favorite. Some people become obsessive over interpreting the lines on the traditional tests. They stare at them forever, trying to determine if the line is dark enough. If that sounds like you might prefer the digital option. It eliminates the guesswork. Now there is a third type of test that is gaining popularity, and its design is intended to give you more than just 1 day's notice. Since sperm can live for up to 5 days in the female reproductive tract, some people want a heads up earlier so they can start having intercourse sooner. These more advanced tests give you 3 possible results: nothing, high, and peak. The peak reading is the LH surge, which is the same thing the basic test detects. However, the high reading is actually measuring estrogen. Remember how I mentioned earlier that a high estrogen level triggers the LH surge? This test is measuring that rising estrogen as a precursor to the surge. So, one metric is measuring estrogen and the other is measuring LH. While this sounds great, this test is also very susceptible to giving false positives in women with PCOS. Those tiny follicles in PCOS each produce a small amount of estrogen, which can elevate your baseline level and confuse the test. I've had patients spend hundreds of dollars on these high-tech tests, only to get false positives and become incredibly frustrated. But to be honest, in my opinion, this more expensive test is often just telling you what you already know. If you have regular periods, you can do simple arithmetic. You already did 30 minus 14 equals 16. You know your fertile window. If you want to identify your most fertile window, which is the 5 days ending on the day of ovulation, you can subtract from that. But since you are already starting your basic tests 4 days before you think you'll ovulate, around day 12 in a 30-day cycle, if you begin having sex around the same time you start testing, you are already covering your fertile window effectively. I am also aware that there are even more complex tests with fancy names and sleek designs that sync with apps and bases. At the end of the day, they provide the exact same core data. They might look pretty and cost a lot of money, but they are not giving you anything fundamentally different. I have covered a lot more about ovulation and other fertility awareness methods in my other videos. Please feel free to check them out, especially my content on basal body temperature tracking and cervical mucus monitoring. If you still have questions about ovulation, drop them below in the comments. I am always happy to answer them. As always, you can find more information right here on this channel to guide you on your journey. Thanks so much for watching, friends, and I'll see you in the next one.